Hi, I'm Kate Marie from Slow Aging. As we get older, our tissues start to shrink and we lose a lot of the elasticity and collagen. Our collagen fibres get all tangled. So what we're doing here is we're having a rejuvenation procedure using my own stem cells.
What I'm going to do now is to put in some tiny injections with some local anaesthetic into the areas where I'm going to put the needle through. There is some local anaesthetic mixed in with the stem cells as well, so when it's going in it should not be particularly painful or bad.
Good.
Okay.
So the local anaesthetic doesn't interfere with the stem cells?
No. The areas that we're looking at treating for you, we discussed before, is across your cheek, and this lower part of your cheek, is that right?
Yes.
And a little bit around your eyes. That's where we're going? Okay, good. We put in just a tiny little bit in this spot. Put in a little bit just down here, because that gives us access to this area of the face. Gives us access to this area of the face. A spot right here on the edge. The key areas in somebody's face that tends to show the aging is this area here we call the malar fat pad, and as it dissipates with age things tend to come down. That impacts on the contours and the quality of the lower eyelid skin, and in the lower eyelids the skin is the finest and most delicate in the body, so it shows the effects of aging quite readily. The lower part of the cheek and the outer segment is usually not quite so affected from an aging perspective, but in the towards the middle it is, because this is the area under maximum movement when we're smiling and when we're making facial expressions. So just give us a big smile there, Kate Marie. You can see how this is the area that moves quite a lot. Just draw your corner of your mouth sideways. That's it, and you can see this is just relax now, that's the active part of the face, and so this little segment in here is really where the majority of the aging effects take place. We're going to do our injecting in those areas. Now, we don't need to place stem cells in every single spot to get a result, because the cells are living organisms and they migrate to the areas that need the repair, and that's why we use the laser stimulation on the superficial areas of the skin to draw those stem cells upwards into the skin, and they'll spread through the area really quite nicely. First injection we're going to go in through here. Did you feel that at all?
No.
Okay, now we're in a very, very superficial layer and just going to lay down a little bit of stem cells just through there. And you can see how I'm fanning out this whole area. And you can see underneath the very fine skin of the eyelid that you can see it going in really quite readily. You might feel this a little bit awkward. You can see the product going in through there. So as you can see, these are the key areas that we would normally look to inject. Everybody has concerns about these little crow's feet lines, and so if we inject some of our products through there, there's a small bruise just coming up in here, and that's not too surprising given the type of tissue that we have. Now I'm going to come down to here, and we're going to head up towards the top lip. This is the area we call the nasolabial fold, and you can see that we're just placing very, very small quantities of this lovely stem cell mixture throughout the key areas of the face. can see that we're concentrating on those most age affected areas in the face. I'm going to run in here towards the lower lip, and it's this little corner of the mouth that is often subject of a lot of aging concerns. Now remember, the objective of this treatment is not so much to create volume, but it's to create an improved textural effect and a quality effect of the skin. And you can see from these few portals, I can actually get access to that whole area of the face, right across that central part of the face. I always find that you tend to do things subtly differently on the left side to the right side, and that really just reflects the fact that the operator might be either left-handed or right-handed. This is the area where it's a little bit more tender and sensitive, because this tissue is just simply thicker and firmer. Now, one of the other advantages to this particular style of stem cell facelift and this injecting technique is that we don't get a lot of bleeding, and so the patients don't look frightful when they leave. Certainly there's a bit of bruising, and that can occur anytime there's an injection into the face, and that'll occur with any technique. But one of the advantages of this technique is the very few injection portals that require painful at all.
Thank God. Hi, I'm talking to John now about aftercare because I'm going off to another practitioner to do the laser. So John, what do I do for aftercare?
Okay, well, as far as the stem cell elements are concerned, these injections we've just done, you shower normally, you wash normally, you can massage if you feel any little bits of swelling at all.
Okay.
That's really not an issue. You can put makeup on, that's no problem either. So there's very, very little post-operative care that's required at this point. What you might feel over the next few hours or even few days is a very, very light, tingly type sensation in your skin. That's actually a good thing if you feel that. Not everybody gets that, but if you do, it's nothing to be worried about. It's actually a very good sign. Now, the next step, as I mentioned before, is we're going to use our laser, our 1064 laser, to stimulate the collagen production, and really it's like putting the icing on the cake for this particular issue. So it works well, and there's no downtime from the laser either, so it's not a burning laser. It's a laser that'll leave you a little bit flushed and blushed for 3 or 4 hours. But apart from that, nothing at all. You can still use your makeup normally and go about your normal activities without any problems.
Okay. When will I expect to see some sort of results, and what would those results be?
In the early stages, what you'll notice is just a little sense of plumping of the skin, and that'll occur over the next probably 3 to 4 days. And that'll be a combination result of what we've injected plus the laser. Then things will settle down a little bit, and you probably won't notice much of anything except that your complexion looks fresher and brighter. But progressively, over a course of some months, the stem cells kick in and they start to work nicely, and that gives you a really lovely feel to your skin. It gives you a better complexion, better texture. It's important to understand that the stem cell is not for putting volume in, so it's not the same as a filler. It's not designed to do that. It's to look at skin health and texture and complexion, and in that sense it tends to do it really, really nicely.
Okay. Thank you, John.
That's
Thanks
all right.
for everything.
Okay.